Thank you, HitCon, for giving the opportunity to be a part of this a different kind of conference where a lot of platform they merge together. Before I start, may I know, how many physicians are there in the crowd? Almost all. Okay. And how many of you practice diabetology? Probably all. Most of them. Yeah. Yeah, please. So just in brief introduction, I am the retina specialist. I work at Coimbatore, and that I'm going to talk about a small innovation that has gained, which is innovation close to our heart, designed by us, everything done in India, and it has gained the global attention in last 6 months. And regarding disclosures, I do have financials to disclose because I own the rights of the global distribution of the innovation that we have. We have applied for the patent both in India and international. So let me start with some of the cases. This was a 43-year-old IAS officer with a diabetes of 5 years. He came to the clinic suddenly saying that, "Doctor, I was pretty all right a couple of days before. But suddenly since 2 days, I see a lot of black clouds." I asked, 2 days before you were pretty all right? He said, "I was absolutely fine. I was going on the fields, and just 2 days that I am seeing these black clouds. I don't know what's happened." This was a 60-year-old homeopathic doctor, diabetes since 20 years. He comes to our clinic, says, "Doctor, I was pretty all right since yesterday, even till today morning. I got up and I can't see a thing. I was pretty fine since yesterday." This was 38-year-old banker, diabetes since 2 years. He says, "Doctor, since last month, I've been finding it difficult in reading my accounts." He said, "I might be, heading to the presbyopic age, so I might need a plus glasses." But if you see the retina, I'm going to discuss, why these all people. Now, if you see what went wrong with these patients, they were all educated. Finance was not a problem. But still, all these people, in spite of having good financial status, in spite of having good education, they are heading towards blindness caused by the diabetes. Probably the major cause is they have not been directed, or the awareness that diabetes can really make you blind was not emphasized strongly. Problem statement, because you are all diabetologists, so I don't need to enhance the problem statement. We have 65 million of diabetics in India, projected 109 million by 2035. We always concern about the cardiac risk, renal risk. We do a lot of things, but I'm not sure how many clinics we do the fundus examination and record it. So let us just go back to those 3 cases. Why they had that kind of fate. So if you just look at this circle, this is a picture of a normal retina. If you look at this circle diameter is approximately 5.5 millimeter. If anything goes wrong within this circle, then you have the symptoms. But if anything goes wrong here, you are completely asymptomatic. That is the problem of diabetic retinopathy. This is a patient. This circle is absolutely fantastic, but if you see, there's a lot of bleeding happening all around. There's a lot of hard exudates. That's what we call in scientific language. Patient has no symptoms, but once you examine, then you come to know that things are going really, really wrong. And by the time this circle has an entry of these yellow spots, the fire is everywhere, all around. It's difficult for us to bring everything back. So now, why that is happening? For example, even some of you, especially I would say in corporate setups, or except corporate setups, you also do a direct examination. A lot of physicians, especially I talk about the old physicians, they have been trained better than us because they were the holistic physicians rather than we as a organ-specific doctors. They used to see, all the direct examination. They can see it. But the problem is, in recent times, the studies have proven that if you see the lesions and you communicate to the communicate to the patient, verbal communication, you tell them that there are some changes because of the diabetes in your retina, you go and see a retina specialist, or you go and see ophthalmologist. There's a dropout of 60 to 70%. Patient, they don't go. There's a thinking that I'm getting an unnecessary referral here. And now the studies have proven that if you show them okay, there's a bleeding all around there. This can come at the center, so you better go and check. Then entire statistics flips. 70% get convinced to go and get a checkup done. So that's where the famous quote of Bernard, falls right, that a picture is worth a million words. So now another statistics, diabetic population approximately 65 million. I would not say anything about the physicians because except big corporates, actually you do not have fundus cameras anywhere. In an individual clinic, fundus cameras are not there. If you go further upstream, we talk about diabetologists, which is a primary level. You talk about the ophthalmologists. There are 18,000 registered ophthalmologists in this country, and there are 1,058 retina specialists registered in the country, and there are some more ophthalmologists who have interest in retina care. Apart from them, approximately 15,000 of ophthalmologists do not have access to fundus cameras. So we are not able to provide the care and evidences even at the ophthalmologist level. Then what to talk about the primary level? Now you must be thinking, why that is all happening. And so that all leads to an unfortunate statistics that 50% of retina specialists, whenever they see the patients, they already lost the vision. And retina is like a neurological disease. If things are damaged, they are damaged for life. You just can't bring them back. You can just make them stabilize. And all that can be prevented. 90% is blindness is preventable. Studies recently surveyed by the Preventive and Global Ophthalmology by the UK, they have done a survey in India. 70% of the government clinic, 43% of the private clinics lack any retina imaging instruments. Now, why that all is happening? Now, this is a picture I am showing. These are the existing fundus cameras that we have. There are some Indian ones also. But you see the structure, quite bulky. So the limitations are, they are quite heavy. So, for example, even if we talk about Bombay, Gujarat, people practice at multiple centers. So, if you have multiple centers, suppose you have stretched yourself to give a holistic care to your patients. You bought a fundus camera, but you can't, deploy that fundus camera each and every day to different centers. Again, that involves a cost. Then they are expensive. They range from 5 lakhs to 1 crore depending on what kind of functionality they give it to you. They cannot be used in infant and children. I'll go back to that picture. If you see that, you need to keep your chin here. I'm sure everybody must have got ophthalmology examination, so they know that you need to keep your chin there. Infants, they can't keep their chin. You need to examine them in a lying down position or maybe in the parent's lap position. So now I'll come to our innovation, which we call as an MI RetCam. MI actually, when I was, working on this side, that was the time when Honorable Prime Minister started the Make in India campaign. I had no name to choose. I chose Make in India. So now it has been named as the MI RetCam. A lot of people call it M2 RetCam, M11 RetCam, but the real name is Make in India Retinal Camera. That's how this entire device looks like. This is the device. Device is inside this. The device cost is 20,000. You can take it any remotest area of this country because it is just in this. Everything is in this. You can use very well in infant and children because you can examine them in parents' lap. You can examine them lying down position. There's zero maintenance because it's mainly a hardware. Software, we have developed an app I'm going to talk about. These are the pictures captured with this device. Hypertensive retinopathy. And now, if you see this picture, I'm not sure, how I can explain you. All these devices, if you see, you need to keep your chin. And then there's a movement. You can shift the machine on the right side and the left side, but there is a restriction. You can just capture the 40 degree to 50 degree of the retinal area, because there is a limitation on the movement. But here, with the help of this device, because you have the complete freedom, you can ask patient to look this side and I can image from this side. So I can capture the entire retina. So these are the pictures which are, high-end fundus cameras, costly fundus cameras, they cannot capture. This is a far, far peripheral lesion. So these are all diabetic retinopathy pictures. We have developed an application because initially we just developed this hardware part. Then we thought, okay, we need to connect people. Because diabetologists, if they, at all they are going to use, they need to have a system where the entire thing can be pushed to the ophthalmologist or retina specialist. So we have an application where you don't need to write anything on paper. Everything, entire patient profile is in your app, which is called the MI RedCam app. All the photographs, they are stored within this application. And you have two options. You can just immediately click and an email, type the email of that particular doctor whom you want to refer, and the entire report, including which hospital you have taken, what kind of comment you make, what kind of decision you want from his side, and he gets a report, and immediately you can get an answer. Now, because of late diabetologists have started imaging and using this device, they have demanded that we need a print option. We want to give a printout to the patients. So recently we have incorporated a printout option also, where you can just have a direct printout from the app itself. So our vision for the country is we would like each and every diabetic clinic, any corner of this country, to be equipped with fundus cam, because that is the only way that you can prevent blindness. Otherwise, prevention is the only way you can prevent blindness, otherwise you can't do it. Now, slightly off track, we want to put this device in the gynecology department, NICUs, because that is the area. Only machine, a machine called Clarity Red came from UK. It costs 1 crore. I'll tell you what it does. All these premature babies, they are bound to get blindness because of the retinopathy of prematurity. And the problem is more serious here. Diabetes gives you at least some time. But retinopathy of prematurity, if it is not treated within 4 weeks of the child is born, the child is blind for life. You can't bring anything back. Now what is happening is we can examine. Now you understand a situation where a child is prematurely born. He was supposed to be born at 9 months. Now he is born at 7 months. The entire family is already in agony. And then you examine that baby and then you say, boss, there is a problem and I want to do some laser treatment for this baby. Very difficult. We have encountered these situations so many times. No parent, they show any willingness to get treatment. So you need to show them that, this is the normal retina, that's how it should look like in your baby. And your baby is already bleeding inside the eye. So get him treated. So to get that evidence, that 1 crore machine comes. Now our device, especially I would thank to the users in Gujarat. They are the pioneers in doing this in Rajkot. They have been extensively using this device in all these premature babies, and we have started seeing the fruits that the counseling becomes so easy. And all the babies, once you show them the pictures, okay, let's get them treated. And the third part is, as I said, to generate a referral system. So that's how, see, these are the babies. These are the hemorrhages that has been captured with this device, and then you can show these pictures that he's bleeding inside. Please get the treatment done. And this is the 1 crore device. This is our device which is functioning. I can mention Dr. Akash Patel, who works in the Rajkot. He has been extensively using the device in very, very low birth and 10 days, 20 days, born babies. We have a lot of recognitions till date. If I talk about the international recognition, we have presented our entire concept to the MIT Harvard group, and we have been awarded as a top 13 non-infectious disease initiative by the BMG Awards. And we have been invited via World Ophthalmology platform, American Academy platform. We have published in European Journal of Ophthalmology, and we were the winner of last year topmost innovation award by the Medicals. National award, we had a couple of national awards, and we were kind enough, Economic Times was kind enough to capture us in April. And this was the highlight. I wrote a Prime Minister of India to his secretary that, sir, when the device was not even made, it was just a prototype, that, sir, this is the kind of concept, this we can help a lot of people. Within half an hour, I wrote at 5 p.m. Half an hour I get an email from the Prime Minister's personal secretary that we will bring it to the attention of our Prime Minister. Next day, 9 o'clock, I get a call from the PM office that Prime Minister has seen your email. He would like you to meet Dr. Jitendra Singh in his office after 2 days. So that's kind of, that, I should not be biased, but I am biased, the way the Prime Minister works. And this is not my story. In my clinic, I have, heard so many stories. I don't know how he works in that way. So I went there. I was directed because Dr. Jitendra Singh, who actually he himself is a diabetologist. He heads the RSSDI. So, but now because he has been elected, so now he is the Minister of State, but he was in the Jammu Kashmir Medical College. So now we launched this device in June 2016. Within 6 months, we are present in 19 countries and 21 states of India without having any single representative anywhere. We have just created a YouTube channel that how to use this device, and people just watch that device. Everything is online. They do order online. Everything goes to them. Instructions goes to them. They start using. Any doubt, we are always available. And we have a lot of encouraging feedbacks. But this is the 65-year-old gentleman again from Gujarat, and he could start imaging in 3 days. And this was so touchy that he wrote to me, the days are not far when my indirect ophthalmoscope will be extinct. Am I at doing what a digital camera has done to Kodak? Extremely satisfying, user-friendly. RTS, congratulations. So these are the comments, which gives you further push. And we have been trying to strengthen our app on both the sides to get it more and more user-friendly. Thank you.